Women weren't mandated to be in clinical research trials until 1993. Just digest that for a moment. So we were using male data to come up with treatment plans for us.
And is the reason that they did not test on our bodies because they felt like our hormones would, which is so ironic because I'm like, that's the point.
That's why we need to know.
Literally the point is you have to be able to have these skewed results because you have to acknowledge that we have more hormones than men do that affect our daily existence.
You used the word that I was going to use, skew. They were afraid that we were going to skew the data, but you are absolutely right. So that's why when you talk about perimenopause, menopause, fibroids, endometriosis, cardiovascular disease, I mean, all of the subsections of female healthcare, there's such a void of data because we weren't mandated to be included in clinical research trials until 1993. Funding, less than 2% of all venture capital funding goes to female founders. Research, so research dollars do not go to us as well. Education. So, there are estimates that up to 40% of women don't know their own anatomy. And doctors aren't trained. Clitoral anatomy was not updated until very recently. Sorry, I went there.
No,
you brought me in here.
It's not even that. I'm just thinking about all the boyfriends that I've had and how they needed a roadmap. Most of them needed a roadmap to figure out female anatomy. And also the first time I actually took a mirror and looked down, I was like, oh my God, what? They didn't tell me anything about this.
Right.
What?
And so many women call the outside the vagina, and it's not. The vagina is the internal canal. It's where we put tampons. It's where babies come out of. And so women are just not taught. And how are you expected to talk about pleasure or pain or a rash or whatever is going on if you can't describe that body part or your doctor doesn't know about that body part?
Well, by and large, our sexual pleasure is never taken into account at all, ever. It's the conversation around sexual health and wellness is rooted in discussing, the male pleasure center, not us.
Well, that was my next point. I feel like you and I are like on the
We're
same
very symbiotic right now.
Yes. So there's 29 medications for men for sexual dysfunction. And
they're all covered by insurance, I think.
Most of them are. There's 2 for women. The first ever male sexual drug was FDA approved under emergency use authorization. So erectile dysfunction was a national emergency given the same...
I'm so sorry. I guess it could be considered a national emergency. I hate when that happens.
Yeah.
When I'm raring to go and it's just like,
Right.
I'm like, do you need a Snickers bar or something? Like what?
What is going on? And wait a second, why don't you have one of the medications that's covered? But for women, the first drug took 6 years to get FDA approved. And to date, less than 5% of providers know about it. Less than 1% of women know about it.
What is this drug?
ADDY. It's ADDYI. It stands for Add Your Interest. It works on neurotransmitters in the brain, and it is FDA approved to treat low desire.
Really? I've never heard of it.
It's called the pink pill.
Okay. I don't need it right now because I'm feeling like I'm having like a resurgence. Like I got a new beau and he's doing the job.
Good.
My skin's glowing.
And you're happy.
Yeah.
But for a lot of women who have lost that want, and because of it, they've lost their own identity because sexual health is way beyond what goes on in the bedroom.
Yeah.
The fact that this drug has been on the market for 9 years and women don't know about it, because when we advertise for women's sexual health, there's no differentiator between porn and sexual health care. And let me say that again. There is no differentiator between porn and female sexual health care beyond contraception, fertility, or infection. Now, if that hasn't pissed you off, I don't know what will.
That does make me very, very upset. It does, because that's another area that it is so easy to shame women for expressing the fact that I don't really need a reason to want to feel sexually aroused and to take advantage of that. Like there is so many ways in which women are made to feel shame for having a natural physiological, biological reaction to something that might arouse them. And it's wildly frustrating.
It's wildly frustrating. And what you just described is the biopsychosocial response to sexual health care for women. You have to take biology, psychology, and social factors into effect. Like, if you're mad at him or her, you're not going to be in the mood, and that's okay. But yes, so pervasive gender bias, whether it's the way we approach women's sexuality, even the nomenclature that we use in medicine is so harmful.
Yeah.
I worked on a project with Peanut, the social group out of London, and we did a renaming revolution. We took all of the words and what
would you say were some of the really harmful words within, the kind of lexicon of, references that are used to describe, women's sexual health? Which ones do you think that were the most harmful?
Incompetent cervix.
I take offense to that.
Yeah, incompetent cervix, for cervix that doesn't. So the cervix is the mouth to the womb, right? We need the cervix to hold a pregnancy in, but some women struggle with that and they will lose pregnancies and the cervix doesn't function.
So would that be like where somebody would need like a cerclage?
Cerclage,
yeah.
Yes.
Okay.
But incompetent cervix, when someone is exhausted during labor, and has been pushing forever. I mean, that's the biggest workout of your life. We call it poor maternal effort.
Oh, these terms are vile.
They're vile.
They're insidious.
Because they're not educational.
Not even a little bit. They're accusatory.
They place blame when you are at your most vulnerable moments in your life. Yeah. So that's the medical system I grew up in. Yet another barrier is time. There was a recent article that an 8-hour day takes a physician 27 hours to complete the work. By the time we see you, examine you, counsel you, chart it, talk to the insurance company, send the medications. So when you feel like you've had a drive-through pap smear, kind of like going through McDonald's, it's not because the doctor doesn't want to care for you. It's because they're stuck in a system that kind of forces this.
It doesn't reward patient care. It doesn't reward bedside manner. It doesn't reward that. It's conveyor belt. Get them in, get them out.
Correct.